lavender has been studied recently for several purposes, including treatment of mood and anxiety disorders, as well as a number of other things. Its analgesic effect, however, its painkiller effect, is one of its most widely studied properties. Surprising, then, that there hasn't been a single documented clinical trial to study lavender for the treatment of migraine headaches that affect tens of thousands of Americans every year, until now. Lavender essential oil in the treatment of migraine headache, a placebo-controlled clinical trial. Migraine sufferers were asked to, at the early signs of a headache, rub 2 to 3 drops of the lavender essential oil onto their upper lip and inhale its vapor for a 15-minute period, and then score the severity of their headaches for the next 2 hours. In the control group, they did the same thing, except they used drops of basically unscented liquid wax. And neither group was allowed to use any painkillers. In the lavender group, 74% of patients had an improvement in their symptoms, significantly better than placebo. Though in the study lavender wasn't directly compared to more conventional treatments, lavender appears to stack up pretty well compared to typical drugs. So lavender helped about 3/4 of the time. High-dose Tylenol only works about half the time. Ibuprofen, 57% of the time. The #1 prescribed drug, generic Imitrex, effective 59% of the time. And then the hardcore treatment they use in emergency rooms where they inject you under the skin, 70%. And all these work better than the original migraine therapy, known as trepanning, where doctors drill a hole in your head to let the evil spirits escape. Conclusion. The present study suggests that inhalation of lavender essential oil may be an effective and safe treatment modality in acute management of migraine headache.